joining by the second. My name is Jeff Bourgeois. I have the pleasure as serving as president and CEO at San Juan Regional Medical Center, and I'd like to introduce a group of panelists we have with us tonight, who will all speak briefly, and then we'll open this up for questions after the speakers have had a chance to provide some various updates. Joining us tonight are Dr. Brad Greenberg, an emergency medicine physician and incident commander here at the hospital, San Juan County Commissioner John Beckstead, City of Farmington Mayor Nate Duckett, Suzanne Smith, Chief Nursing Officer at our hospital, Chief of Police Steve Hebby with the City of Farmington, San Juan County Sheriff Shane Ferrari, and from the Department of Health, Dr. Laura Parahone, thank you for joining us. And then we also have George Duncan, City Manager at Bloomfield. We understand how fatigued many of our community members are from the length and the impact of this pandemic on San Juan County. We're here tonight as community leaders to provide you with updates and to answer questions for those of you who have joined tonight. We now have over 80 participants. And also, and perhaps more importantly tonight, we're here to ask for your support and your help in working together as a community to ensure that our precious healthcare resources are there for all of us when we need them. So thanks again to our panelists and to our community members who have joined. And Dr. Greenberg, let me turn it over to you first, please, sir.
Thanks very much, Jeff. I wanted to give a quick update about where we are in the hospital and what the status is as of this afternoon. So as of 3 o'clock this afternoon, we had 169 people in the hospital. Our COVID plus persons under investigation number is up to 90. And 10 additional folks are holding in the emergency department for a total census of 179 with 15 intubated patients. So these numbers continue to climb. Two numbers that I did want to draw everyone's attention to were the numbers released today by the New Mexico Department of Health for San Juan County. We've been following the percent positivity, and the percent positivity as reported today was over 19%. It had been at 18.05%, but that is a very high number. And the other number that we like to keep track of is the case rate per 100,000. And unfortunately, our case rate per 100,000 jumped up significantly. If you might remember, the case rate per 100,000 was one of those two metrics that we used in that red, yellow, green structure that we had in 2020. And it was if you had a case rate per 100,000 of 8 or more, then you were in a high risk category. Well, our case rate per 100,000 as of today is 125.2. So it's gone up considerably from last week when it was 104.5. So we continue to climb, and this climb in our community has resulted in considerable stress and strain on our healthcare facility. I'd like everyone to understand that we are doing the best that we can to position additional resources, personnel, and equipment to make sure that we're able to take care of the healthcare needs of the Four Corners. That being said, after considerable deliberation and evaluation of our resources, last week we did declare crisis standards of care. And so we are moving towards adapting our spaces, staff, and supplies in a way which is a little bit different than normal, but we're really doing our best to try to do the greatest good for the greatest number. We continue to work very hard to get out of crisis standards of care by trying to find additional resources. And I know that Suzanne may comment on some additional resources that we've received from the state and the federal government, which we're very grateful for. But I think the impact of this pandemic is right now, at this time, the most severe at our facility that it's been since the beginning of this pandemic in the beginning of 2020. And I think I'd like to draw the attention to the vaccination rates. We hope that everyone's getting out there and getting vaccinated. And please, I'm going to be extra clear. The most important thing that you as an individual, you or your family, your friends, your loved ones could do to try to get out of this pandemic is to get vaccinated. All of the vaccines available are safe. The vaccines approved in the United States by the FDA and the CDC are safe and they're effective, and they're widely available. So we still have relatively low vaccination rates in some areas of our county. And these areas include, I think, some areas of Bloomfield, Aztec, and some portions of Farmington proper as well. And these vaccination rates really do need to come up. We need each and every one of you to go get vaccinated, get your questions answered, ask your questions now, and we will do our best to try and respond to those. But these vaccines are the most important steps to get out. I'd like to say, draw your attention to a couple other numbers. In our hospital right now, our hospitalizations, 81% of those hospitalizations are folks that are not vaccinated. In our ICU, 91% of those folks are not vaccinated. Folks that have to be on a ventilator, 91% are not vaccinated. And and all the folks that have died in the last month from COVID-19, 94% have been unvaccinated. Our crisis right now is a crisis of the unvaccinated. And I implore you to get your questions answered and get a vaccine. Now, the benefits of the vaccine, they are what the numbers that I've just described describe an absolute reduction in severe COVID. You're less likely to die, 10 times less likely to have require a ventilator or intensive care after becoming vaccinated. The impact of getting vaccinated is that we will all collectively as a community be able to emerge from this pandemic wave. And so, again, I implore you, let's get your questions answered. Let's try and make sure that you have access to these vaccinations. They are now available, the Pfizer vaccines available for children ages 5 to 11 and 11 to 18. And then the Moderna vaccine and the Johnson & Johnson vaccine are available for those who are 18 and older. So these very, very important tool, the most important tool to get out of this pandemic. Now, fully vaccinated, by the way, is a definition it's pretty easy to remember. You need to get either one shot for the Johnson & Johnson or both shots of the Moderna or the Pfizer vaccine. And then after 2 weeks after your second shot, you're considered to be fully vaccinated. Boosters come later. Don't worry about the boosters. Just please go get your initial vaccines and we can get through this together. Thanks, Jeff. Back to you.
Yeah, thank you, Dr. Greenberg. Well said. And just for point of clarification, all those percentages you were mentioning, they were percentages of our COVID-19 hospitalizations, and the pretty remarkable numbers that show the benefit of the vaccine. Let's move next to San Juan County Commissioner John Beckstead.
Thank you, Jeff. I think that the thing that the county is focusing on is doing our best to support the hospital. That's one of our main focuses is to support you all, and in recognizing that that people are almost to their breaking point. Your employees, these nurses and doctors who are dealing with this. I think it's frankly important to look at the percent of COVID patients that are unvaccinated that are having more difficult times dealing with the virus. I know that there are a lot of people out there that for whatever reason haven't had the vaccine, don't want the vaccine, and a lot of it I think has been being rubbed the wrong way or hearing a message that they didn't agree with and they've just made up their mind. But in looking at these numbers, I think that is a way or frankly going to be the thing that changes people's minds, because it's hard to deny the numbers. I mean, 91% and 94%. That's huge. And I think that if those numbers are put out in a way that people can just consume the data instead of feeling like they're having somebody else's ideas, or whatever these preconceived ideas are about the vaccine. If they just look at the raw data, at least that's how I'm driven. And in looking at those numbers, it's hard to deny that they're not, the people that are unvaccinated aren't being affected more. And that directly correlates with the number of people that are in the hospital, and directly correlates with the stress that's being put on our nurses and doctors. And I think that a shift in message to that data-driven, the data-driven numbers might be the way to go to for some of those people that aren't vaccinated. We got to find a different way to reach out to them. And in looking at those numbers, that's probably the way to do it.
Well, thank you, Commissioner Beckstead, and thank you for the support from the commission and the county, and the well wishes for our caregivers. They certainly have been taxed over the past 20 months. Let's move next to Mayor Nate Duncan from the city of Farmington.
Good evening, everyone. Thank you, Jeff. I appreciate the San Juan Regional Medical Center bringing this town hall together. I think it's something that the community has definitely been needing. And, we're here tonight to answer questions. As, Commissioner Beckstead mentioned, I mean, the data that's being given to us certainly is reported by Dr. Greenberg and has been reported to the stakeholders here in the county over the past few months. It's intriguing. I mean, it's intriguing to see that 81% of those who are hospitalized with COVID are non-vaxxed, and 91% who are in the ICU are non-vaxxed. I mean, I think you have to let that data speak for itself. But I certainly recognize, as the husband of a nurse at San Juan Regional Medical Center, on a daily basis, hearing reports of individuals who are my age that are on the COVID unit that are having struggles breathing, and just know that how stressful that is for their families, for their kids, and that worries me. Certainly we hear the voices of individuals who are frustrated, and we get what Mr. Bourgeois had mentioned earlier, the fatigue that I think not just our community is experiencing, but communities across the globe. I mean, it's becoming, as we continue to try and digest all the news that comes every single day, and when the vaccine is given to us as hopefully this long-term solution, and we see individuals who are vaccinated who are still ending up receiving or catching COVID, you kind of question the things that are going on. But for me, as an individual who chose to get vaccinated and who weighed this out, kind of a cost-benefit analysis and what the risks are associated to me, my family, and knowing in my position that I have a desire to be in front of people, to speak with people, that's the kind of person that I am, that's why I made that choice. I consulted with individuals that I trust, were in my circle of friends and family, and certainly my doctor, and asked the questions that I thought were pertinent based upon my own self-interest, and certainly the interest that I have for those around me and protecting them and other people. But I think everybody's got to make that assessment, and it helps, to see that as a county we have certainly a very high percentage of individuals who are vaccinated. And I think that has benefited us, but I think there's certainly some ground that we can gain. But again, this is a personal decision, and I respect individuals in making those decisions for themselves. But I think it is a cost-benefit analysis that has to be assessed, and recognizing certainly from the position of the mayor, the way that this pandemic has influenced and injured in some ways our workforce, the way that our teachers, our healthcare workers, our first responders, parents of students, I mean, everybody is being impacted in some way or another. I receive, I believe, an email every day from my son's school of an individual who is at his school who is tested positive. This pandemic continues to go on, and we have to stand up to it the best way that we can possible and overcome that fatigue and do the things that are necessary to make sure that we're helping minimize that spread to the best of our ability. And sometimes it's frustrating because you may feel like you're doing all you can, but the pandemic continues on. So we're seeing this happen everywhere. From the city of Farmington, just a brief report. At no other time during this pandemic have we seen so many of our employees test COVID positive, and that is certainly, it brings concerns when it comes to providing services, which we've obviously maintained to the best of our ability. But there are, we want to make sure we keep those people healthy, we keep them in the workforce, and we keep them serving the community to the best of their ability. So again, thank you to San Juan Regional for putting this together tonight. I think it will be very beneficial to our community.
Thank you, Mayor Duckett. Appreciate your leadership at the city. Let's move to our Chief Nursing Officer here at San Juan Regional Medical Center, Suzanne Smith.
Thank you, Jeff. As Dr. Greenberg pointed out, San Juan Regional Medical Center is experiencing very high inpatient census and emergency department volumes. This patient volume and the intensity of the care requirements has taken its toll on the nursing staff, indeed on all hospital staff. They are physically and emotionally drained. They are working very hard to meet the needs of the patients for whom they are caring. They are giving of themselves to care for our community members and are deserving of the community's respect and gratitude. In order to respond to the increasing demand on hospital staff, we requested assistance from the New Mexico Department of Health and the National Medical Disaster System to provide nursing and support staff. Those resources came in the form of registered nurses, paramedics, physicians, pharmacists, respiratory therapists, nursing assistants, and we are very grateful for them. They are, however, a short-term resource, and we know that the volumes that we are currently experiencing are slated to extend into the next coming months. As we transition fall into winter, we gather more indoors and in closer contact. Be situationally aware and cognizant of your surroundings. It's imperative that each of us adhere to COVID-safe practices, including consistent hand washing, wearing of a mask, and social distancing when in public places and when you're with people that are outside of your close family. San Juan Regional Medical Center has continued to provide for safe visitation practices of hospitalized patients. We recognize the value of personal interactions with loved ones, particularly in these very stressful times. Visitation practices for the COVID care environments have some guidelines to assure that the safety of both of patients, of the visitors, of the staff. And we ask the visitors to patients in the COVID care environments schedule their visits that they so that they can be escorted to the care environment by a staff person who can teach them to safely put on and put off their personal protective equipment. We know that the very best way to prevent infection or even to mitigate its impact is to be vaccinated. If you're not vaccinated, I implore you to reconsider and help us end this pandemic. Thank you, Jeff. Back to you.
Thank you, Suzanne, and thank you for your advocacy on the part of our nurses and other frontline caregivers. They have been through a lot. Let's move next to Chief of Police Steve Hebby with the City of Farmington.
Thank you, Jeff. Can you hear me? Good to go.
Yep.
So I apologize. I look like I'm Nicole Brown on there. We've had some technical difficulties getting signed in today, so I'm using my PIO's phone. I thank everybody who's tuned in tonight. I thought that it was important that we have one of these kind of community discussions and that the police department play a role in it. During my time with the department over the last year and a half, we've really seen both sides of this pandemic. In the beginning, we took a lot of precautions. Our staff was restricted from the number of calls that were going on and the types of calls that were going on. And really, we went months and we did not have a positive within the police department. And then it went into kind of remission. Things started to come back. The police department began resuming normal operations, or at least closer to normal operations. And then we were hit with this second wave. In the second wave, at least anecdotally, I'm not a doctor and I don't play one on TV, but I will tell you that as a director of a police department, I've certainly seen the impact being different. So we still are in masks, and we are using proper protocols whenever we're in situations that could put our officers at risk. And we are obviously following the mask mandate within the building here at the police department. But the rate of exposure for our officers and the number of positive tests is many times what it was during the first wave. So this pandemic portion seems to me, anecdotally, to be much more contagious. My officers are testing positive at a significantly higher rate, and that is concerning to me when I take the second part. And the second part is one of the things that I've done as police chief here is I send out condolence cards. I send out condolence cards to citizens here in Farmington that are killed or die, and our officers are involved in the investigation in some way or other. And then I also do that at the national level to police officers. I send a condolence card to the families of officers who die in the line of duty. And what I've seen over the last 4 to 5 months is the ages of the officers involved. First of all, the number of officers has greatly increased that have been dying, but the ages of the officers significantly younger. So the initial wave, a little over a year ago, close to a year and a half, most of the officers involved in those were in their 60s. And they oftentimes were jailers and things like that, maybe in civil procedures, working in sheriff's offices. And what I'm seeing now is you have an increasing number of employees who are dying, and they're in their 40s and 50s. And sometimes they're down into their 30s and 20s. Although that's rarer in the 20s, the 30s, 40s, and 50s have really increased. And what that's telling you is not only is it more contagious, but in particular for people that are not vaccinated, more people who are younger are passing away through this stretch. So to me, as a director, I'm concerned for my employees. I certainly do not want us to have a Farmington police officer die as a result of a COVID exposure. We need our police officers out on the street, so they are continuing to do the job, and they've done it for the last year and a half. But what I would tell you is it is a concern for me to hear what the hospital is going through, but it is also a concern for me what this could ultimately mean for our police department if we're not able to field the adequate numbers to keep our city safe. So it is something that we worry about here at the PD. We worry about at the city level. The city manager, the mayor, and I have discussions about what we're doing and how we can continue to provide the service that we should be providing. But I am vaccinated. My wife is vaccinated. I understand there could be reluctance. I understand some people may not, and maybe they have medical conditions that would preclude it. But I would tell you that you should talk with your doctor, that you should have a good conversation on it. It's been a year and a half. I've continued working the entire time. I've never had the COVID as a result of, despite all the interactions I've had. And I would tell you it's a result of being vaccinated here. And I was vaccinated in the very first wave. So I take it seriously. I understand reluctance, but I would urge you to listen to the people on this call and consider getting vaccinated. I think that is the way to keep you safe and certainly help us keep our medical services and our police department operational. Thank you, Jeff.
Thank you, Chief Ebby. Appreciate your participation tonight. Let's move to San Juan County Sheriff Shane Ferrari.
Good evening, Jeff. You hear me okay?
Yes, I can.
Okay, good. And I want to start off with, Nicole, you've never looked more beautiful. But in all seriousness, as sheriff, I'm concerned for our community right now. I'm concerned for my deputies. We have been impacted by COVID, not only inside my agency, where everyone knows right now law enforcement agencies across the country are having difficulty finding law enforcement officers to fill our vacancies. But bringing COVID in, it's made it even worse. We have to have people out, when we have to shut down our operations or our facility to be cleaned. It definitely disrupts the services that we provide to San Juan County. Now, in that, we are seeing a greater exposure rate to our deputies than we did in the first wave, similar to what Chief Hebby talked about earlier. And we recognize that. And we are, as many departments on here that are talking about, still practicing safe COVID practices, social distancing, wearing our masks where necessary. And we've seen this outside of law enforcement. It's our partners that are being directly affected. Now, obviously, we work with the hospital very closely. Our deputies have relatives, family members, wives that see the impact also directly from San Juan Regional that are working there, and they share their experiences from there. Our dispatch center was taken down to its knees here not too long ago with that. We have our detention center who has experienced a very high rate of COVID going there, not only for the inmates, but for the guards that work in there. So we've seen this on many levels. And as with everybody on this panel, whether you're a panelist or somebody who's listening in, I really think it's been highly politicized to the point that I know I've received calls where it's turned into this political war more than anything. I got 2 calls yesterday about buses coming into our area to vaccinate children without parents' consent. That's not happening. That's not going to happen. So stopping some of that bad information that's out there, I think is key. Whether it be people's feelings toward the vaccine, where they go on these tirades about incidents that don't happen. I'm not directly part of any medical organization or anything else, but I do hear a lot of the rhetoric coming out of that. But again, as of right now, it's still a personal choice. And like what Duncan talked about earlier was you need to have that conversation with your doctor, decide if that's the right avenue for you. If you choose not to do that, care for your neighbor, care for your loved ones, practice PPE, wear your mask, wash your hands, don't get out. If you choose that route, then you still have a responsibility. You have a responsibility to your friends, you have a responsibility to the community, you have a responsibility to yourself. And it's difficult getting past this when people just throw up their arms and say, I'm not going to do anything. I understand that, but you're feeling towards that, but we're spinning our wheels here. And, looking at the numbers right now that are coming from the hospital, I'm very concerned. If something was happening to me and I couldn't get a room, I heard from somebody the other day that they couldn't find them a room, so they were in the ER. I hear people being in the hallways. They have to understand we're at a breaking point. But please do your homework. Please, when you hear these things about buses coming to vaccinate our kids, vet that. Call me. Call law enforcement. But let's definitely get all that bad information out of the conversation. Thank you.
Thank you, Sheriff. Next, move to Department of Health Representative Dr. Laura Parahan. Welcome, Dr. Parahan.
Hi, thank you so much for having me here today. And I just want to thank everybody for their words and just encouraging you guys to just thank you so much for all you guys are doing in your community to really try to stop the pandemic. I think that one of the things we're seeing overall in the whole state is that we're seeing several things that like many of you guys have referred to. The Delta is so infectious. It's not the same COVID as we had at the start of it, right? So like many of you have referred to, this is twice as infectious as the original one, which means that instead of infecting 3 to 4 people, every person with COVID is infecting 8 to 9 people. So you're seeing this massive transmission of COVID. So we're seeing the Delta, the Delta amongst people who are unvaccinated, like you all shared. This has become, most of the people who are dying and hospitalized have become, it's a crisis of people who are unvaccinated. So that's one thing that we're seeing is that even though New Mexico overall has a 72% vaccination rate for people who are over the age of 18, we still have a percentage who are still unvaccinated. That includes kids 5 to 11-year-olds. Now we just opened that up to vaccinate them. So that's another opportunity to have another group that's protected. And so I think it's just important to recognize that San Juan, you guys did a great job of vaccinating your population, but the unvaccinated people are still the ones who are getting sick and overwhelming your hospitals. And it's not just San Juan, but we're grateful that we could send you 76 staff to help out. But I think our biggest work is as a community, how do we protect each other? All the things you guys said about, getting the vaccine, social distancing, wearing a mask, all these things will help us. The other thing that we're seeing is, as many of you have referred to, fewer people are wearing masks. People are just going back to feeling like the pandemic's over, but it's not over. So that's one thing that we're seeing too, is that it's not just one single thing, right? That's still causing the surge. And then the other third thing we're seeing is that with Delta and waning immunity, we are seeing more people who are vaccinated get COVID, right? And obviously the vaccine isn't going to prevent all COVID cases, but it's going to prevent hospitalization and deaths, right? So people who are getting COVID now who have been vaccinated because of the waning immunity and also just how infectious Delta is, that group is also contributing to spreading the virus, and also some of them are getting sick. So it's really important, I think, to just recognize that we have multiple layers of how we beat this, right? Vaccine is a super important tool for us to use, but also mask wearing layered with, social distancing, with making sure we avoid really large mass gatherings. I think all these things together, all the different pieces we do together will help us keep your hospital from getting overwhelmed, and keeping your community safe. So I just want to, just applaud all the work you guys are doing, and just having a town hall where people can ask questions and be able to, try to figure out what is the best way that they can do to help their community and, like you said, keep your loved ones safe. So thank you so much for having me here, and thanks for all you're doing.
Thank you, Dr. Perrone. We have over 190 participants, so we'll wrap up with our last panelist, George Duncan, City Manager at Bloomfield, and then we'll turn to the questions that are starting to appear in our chat. Go ahead, George. George, can't quite hear you. Are you on mute?
Pardon me. Thank you, and thank you for inviting me to the. I'll keep it short. Everyone said it probably best. You don't need to repeating that. I will say that I have been vaccinated, and I would urge others to get the best information. Speak to your physician. Speak to others that you trust. Weigh the benefit, the risk. Go get that vaccine, simply. I got the Moderna. I got both, first shot, the second shot, and the booster. I had no ill effects. Obviously, everyone has to make that decision on their own. The other thing, real quickly, I have the honor of serving as the chairman of the 911 Center here in San Juan County, and Chief Hughes and Sheriff Rory both serve on that board as well. We went without having cases COVID within the dispatch center for a year. Then just a few weeks ago, it hit us, and hit us hard. So that is the first line of defense when you call for help, that 911 center. So it has been affected, and we to battle that. So I'd ask people to make some really good decisions and consider that vaccine.
Thank you, George. Well, very good. Thank you all panelists for your comments today. Roberta, I see a few questions here, so I would like to direct these first two to Dr. Greenberg. First is about testing locations available in San Juan County, and then secondly, can vaccinated people spread the disease? Dr. Greenberg, please.
So there are many locations to get tested in San Juan County. The two of them that to bring to your attention do include the curative testing site at McGee Park. In addition, there's a vault testing program sponsored by the state where they can mail a test to you as a New Mexico resident, and you can send that in. In addition to those two locations, there's really so many different places to get tested, both at physicians' offices, pharmacies, as well as Home tests you can do at home. So if you are feeling ill and you believe that you need to get a test, it's widely available. The next question is, can vaccinated people spread the disease? We do believe that vaccination has been initially very effective at suppressing symptomatic COVID. That being said, the Delta variant has caused significant breakthrough cases, especially in those that have been vaccinated. There have been a number of case reports in which vaccinated persons do indeed spread the illness. And so what really that brings to mind here is that COVID-safe practices need to continue as well. So if you are sick or around someone that has been ill, may be at risk for COVID-19, or if you're going to be in areas that are somewhat congested, wearing a mask, doing appropriate hand hygiene, and social distancing remain very important things to take into account in order to mitigate the spread of the disease.
All right, thank you, Dr. Greenberg. Let's see. The next question is, how do we encourage businesses in San Juan County to support the public health mandate to mask up and attempt to prevent the spread of the virus? So I'll turn that over to our community leaders. Anyone want to take that one? Well, I would just say that I hope the messages that we all shared tonight can serve as encouragement for everyone to understand the severity of the impact that this virus is having on our community, not only for the hospital, but to just about every business owner operator in town, with many, many more impacted employees and what that does to the workforce, and then consequently those businesses' respective abilities to conduct their operations, whether it be the 911 call center that George mentioned, the police officers that Chief Hebby mentioned, the impact on the sheriff departments, and Mayor Duncan also mentioned the impact on city employees. We need to encourage every business owner and every business person in town to support the public health measures, but also encourage all of our citizens to follow them as well.
Jeff, I'll say something on that as well.
Thank you.
Just in regards to encouraging these businesses, the best way to encourage a business, in my opinion, is to put your dollar where you feel safest to put your dollars. If you don't feel safe in a business because you don't believe that they're providing a safe environment for you to be there, that is your choice to shop there or not to shop there. Letting those individuals know who are operating that business your concerns on whether or not they're following the public health order or not. Again, that's something that you direct towards that business. And I think in those ways, we encourage those businesses. And a lot of people are basing this off of what their constituents or their shoppers do or don't do. But certainly if you're an individual who's concerned about that, I would advise you to address that with the management of that store or choose to shop where you feel safest to spend your money.
Thank you, Mayor Duckett. The next question is, how is the rise in cases going to impact, I'm sorry that I jumped around, going to impact the operation of the county's public schools? We don't have anyone from the school districts here tonight, but I do know that with positive cases both among faculty, other staff member, as well as students, it creates absenteeism. It creates a challenge for the school to staff appropriately with the needed teachers and other staff. John Beckstead, I don't know if you have any insights on that, or Mayor Duckett, you have anything that you could share about awareness going on at the schools?
Well, my experience has been each of these schools are obviously they're underneath the guise of whatever districts they're operating underneath, and they're underneath the public education department. and I'm not sure exactly what those guidelines are for them, for whether or not they stay, in face-to-face session or if they're going remote. We know here, I believe there's been 2 schools here in the city of Farmington that have gone back to remote learning. And I know there's others that may be on the cusp of that just based on the current spread of COVID. But it would be good, I think, in that, for that question to be directed to those superintendents of the schools.
I agree. Thank you. Next question, Mayor Duncan, is directed to you about the city allowing indoor meetings at the Civic Center and Gateway Museum, among others. The question is, why is the city allowing that?
We're still abiding by the public health order and mandating that indoors you have to wear masks, and those are part of those indoor facility requirements. For the organizations that are wanting to utilize those buildings, obviously we're hoping they are also abiding by that order as well. And for those attendees who are there, taking responsibility for themselves and attending the event and B, following COVID safe practices.
Thank you, Mayor. Next question deals with, will the city and county, being among the largest employers in the county, mandate vaccines for its employees?
I'll jump back in here, Jeff. There's a couple things that go into that. One, as a person who believes in freedom and liberty as provided through the Constitution of the United States, I believe there may be a question of whether or not that's legal to do, constitutional to do. Right now, we are, as most industries across the United States, are being impacted by workforce issues. And I think in general, when you're trying to facilitate city services to the best of your ability, putting any type of thing in place that may force an individual to quit their job and go elsewhere when you need them to provide that service, that's something that I question. I personally have questioned the vaccine mandates that have brought down to our healthcare workers. I've put out my personal views on that. Again, we're in the midst of something that is historic, and in a moment that we're facing so many different challenges from so many angles. In this point in time, I don't understand the philosophy of mandating somebody's employment based upon whether or not they're going to receive a vaccine, which we now see the vaccine, people are still getting COVID with the vaccine. So I think from that standpoint, at least from my office, that's my belief, and I certainly think I can speak for our council in regards to that, but I'll allow the county to respond as well.
Thank you.
And Jeff, in regards to that, the county is currently, we're analyzing the new Osha guidelines that have been put out, watching that closely. I don't think it's the county as far as, and I can't speak for all the commissioners, but I don't think the commission is inclined to mandate our employees to be vaccinated. We are going to be looking at those OSHA guidelines and assessing those as to, what we're required to do in that regard, and to give our employees the options that are available under those guidelines, and watching closely what is going on in the courts in regards to those. But as far as I'm concerned, the county's not looking at mandating any vaccinations at this time.
All right, thank you. Dr. Greenberg, I think you or Dr. Parahome might be able to help with this next question that says, how can we consider the vaccine to be safe when the VAERS data shows adverse events and deaths in the tens of thousands? First of all, is that an accurate assessment of the number of adverse events? And then maybe speak again to address the safety of the vaccine.
So the VAERS data set is basically not a moderated data set, which has a number of, basically anyone around the country can put in data that's their own experience after receiving a vaccine. It's not inherently moderated, and it's basically unfiltered. And so it is very important to look for, severe or unpredictable kinds of adverse events. But it doesn't necessarily represent the same kind of randomized controlled randomized, double-blinded, placebo-controlled trials that with the significant follow-up that happened afterwards to really look at vaccine-related events themselves. So VAERS data is a sort of a population-based tool, but the vast majority of the reactions and whatnot that are reported are those that are consistent with what most people experience. And those include things like fevers, chills, body aches, headache, fatigue, etc. So, Dr. Powerhone, any other additional comments about the VAERS data set?
Not so much about the VAERS data set. You did an amazing job on that, but I just wanted to share that, there's millions and millions of people who've gotten this vaccine, and it is actually life-saving. It has prevented so many hospitalizations and deaths, and has been really such an amazing tool for us to save lives. So I just wanted to say, on the flip side, it has saved so many lives. So I just wanted to add that. Thanks.
All right, thank you. Dr. Greenberg, I may throw this next one back to you again as well. Do the Navajo Nation COVID cases affect San Juan County COVID cases? I think the intent of that question may be, are the case counts from the Navajo Nation included in San Juan County's case counts?
So the short answer is some of them, because they're part of our community too, and some of the Navajo Nation exists within San Juan County as well. So I think that also the hospital itself also cares for a good portion of the Navajo Nation as well, and we are a hub hospital for some of the Navajo Nation hospitals that are within the Indian Health Service. So I guess one is statistically, yes, partially, but not completely. And then the other part is they absolutely are included in the impact to our healthcare infrastructure. I will say, however, that they had on the Navajo Nation, there was a fantastic compliance rate with vaccination. And so far, even though they too are experiencing an uptick in cases, it has not been as pronounced as it has been in other portions of the county thus far.
Right, thank you. I have a question here. Has the county thought of any ways to be proactive in promoting COVID-safe practices and reiterating or possibly re-educating the public that unvaccinated people should not be in large gatherings and still practice social distancing? Commissioner Beckstead, that was actually directed at either the city or the county.
Well, and I know that we have promoted COVID safe practices through social media, through news releases. Other than that, I don't think that we've focused on any new or different ways to promote that. But we have supported the hospital in the messaging that the hospital has put out regarding that, and done that through social media. I know, and I don't want to speak for Mr. Mayor, but I know that he has done the mayor's table. I know they've discussed that on that platform. So I'll let him address that. But really the most effective way to reach out to people is through social media, and that's what we've been focusing on.
All right, thank you. Mayor Duncan, any additional comments?
Yes, sir. Thank you, Jeff. Thank you, John. From the very beginning of this pandemic, we have obviously implemented the San Juan County Office of Emergency Management, which has kind of become the center hub piece for all the stakeholders, whether it's county, city, schools, hospital, college. Everybody's kind of been in that, and we've utilized that Facebook page, that social media presence, to continue to push out data and information in regards to COVID. The mayor's table has also become a platform where we have utilized that in many places to bring San Juan Regional Hospital on, as well as local medical providers who've spoken in regards to COVID. Certainly, this tonight is another tool that's being used to just continue to raise the awareness. But I think and it comes at times when we see kind of the virus ebb and flow, and certainly in a situation where you're seeing an incline here in cases and hospitalizations, it definitely begs that need for us to continue to voice that message and make sure people are aware of what's happening. So I encourage people to continue to use Facebook, the New Mexico Department of Health website, Facebook page, the San Juan County Office of Emergency Management, San Juan Regional Medical Center, the City of Farmington, San Juan County, and all of us are continuing to put out information as it comes. So I mean, it's there in front of people. The deal is, as it is with any type of information that anybody's trying to share, is if people aren't looking for it, they're not going to pay attention to it. And so there are certainly going to be those who see it, they've turned it off, and that may be the case with many people. We as diligent citizens need to be continuing our own personal efforts, taking care of ourselves and our families to the best of our abilities.
Thank you. I think all of our participation here tonight is evidence of our continued support of COVID-safe practices. This one goes back to our clinicians on the call. What data is available that shows acquired immunity from having COVID is less effective than the vaccine?
So this very common question that we get about, if I've had COVID, do I need to be vaccinated? And if I've had COVID, how good is my immune response and how long does it last? Those are great questions. And I think that we also do have some better data, and it's getting better and better as time goes on. So I think it is important to note that folks that have had COVID do have related a subsequent amount of immunity. Now, the amount of immunity from person to person afterwards is highly variable. And it also is highly variable how long that it lasts. And so folks that have had COVID once can absolutely get it again. And especially when we have a number of variants that follow. So we do talk about natural immunity, and we do talk about how after you've had COVID, sometimes COVID tests can be positive for some time, but you may test positive but you could still actually be vulnerable. So we actually do recommend, and the evidence does support, vaccination even after you've had COVID. So when do you get vaccinated? Initially, there was guidance that said you needed to delay. That is no longer the case. Basically, if you've had COVID or you have COVID now, you can wait 10 days from the onset of your symptoms, and then provided that you're basically well enough to go back to work, and you're no longer significantly symptomatic or you are improving, you can get your vaccine at that time. So if you get COVID between your vaccinations, the same things apply. Basically, the natural immunity from a COVID infection is not as durable or predictable as that from vaccination. And as everyone knows from seeing the press, even immunity from vaccination is something that we are learning about as we go on, as we're moving on all together through the pandemic, right? So it looks like about 6 or 7 months after the second dose of your vaccine, there's some evidence that does suggest that certain vulnerable populations or folks that work in high-risk areas need a booster. And so the booster program was rolled out. So if you've had COVID, your immunity doesn't last forever, and it's highly variable, and you still need to be vaccinated.
And I just want to support what Dr. Greenberg said too. There have been many studies that have now come out that show that the vaccination, you are much more protected than if you actually have a 2.3 times more probability to get reinfected if you just got natural COVID than if you got the vaccine. So that's actually really good evidence too, to just support the importance. And we're also thinking more and more that this booster dose could be just the third dose we get in a series. Like normally we get hepatitis B vaccine and we get the first dose and the second dose, and then we get a third dose 6 months later. Like this could be just similar to that. We're just getting more and more science and learning more as we go along. But the booster dose, like Dr. Greenberg said, is so important especially for our 65 and overs and anybody with any comorbid illnesses like comorbidities. It's going to protect you right now. So just another plug for the booster for those who haven't gotten it yet.
Right. Thank you. Another clinical question. please address early treatment and availability of Regeneron, which can prevent hospitalizations and deaths.
Sure, happy to address that. So we're actually, we've been offering at San Juan Regional Medical Center monoclonal antibody infusion therapy for months and months, and we are now offering, I believe, up to 80 slots per week for monoclonal antibody infusion therapy. Please also understand that other facilities around the region are similarly offering this kind of service because we all strongly believe that folks can indeed avoid hospitalization and severe COVID with early administration of monoclonal antibodies. So it's broadly available in our community. The slots that we have every week do fill up. But talk to your clinician. The clinicians in our community have indeed we have a pretty smooth process for inclusion into this program. Of course, monoclonal antibody infusion therapy has been shown to reduce hospital admissions if given within the first 10 days of the onset of your illness. In addition, there are a number of other inclusion criteria and exclusion criteria that are important to make sure that we're giving this medicine to those that can benefit from it. So I think thanks for mentioning it, because I think it's a great resource. That being said, I will again say the best way to stay out of the hospital is to get vaccinated. Monoclonal antibody infusion therapy, as well as the other inpatient therapies that we do have available, are really only marginally better I would say good at treating severe COVID. Really, we need you to get vaccinated and stay out of the hospital altogether.
All right, thank you. Our host, Roberta Rogers, is able to see some questions that we're not able to see here. So, Roberta, offer you the opportunity to share those questions with us.
Okay, how long do you have the 76 staff members support from the state? How does this crisis affect the overall quality of care for New Mexicans?
So there are two groups of resources that came. The one from the state, that is a 30-day deployment, and they began filtering into our hospital in various days last week. The federal resources from HHS, that's a 14-day engagement that I believe, Dr. Greenberg, correct me if I'm wrong, began officially last Thursday. So 14 days would end roughly, a week from tomorrow. And the second part of that question, Roberta, was what?
Okay, how does this affect the overall crisis in New Mexico and the quality of care offered to New Mexico?
The additional resources we've received are helping us meet the current patient care volumes. Our volumes are much greater than budgeted and much more than we would typically plan for in a normal year. Hospitals and healthcare organizations, just like other businesses represented here today, or agencies represented here today, are really struggling with staffing. So across the country, hospitals have been challenged due to staffing limits to provide the level of care that they would normally desire to provide. There was another question in the ones that I can see that said, basically, are we able to provide care for non-COVID patients? And the answer is yes. We would encourage anybody who feels they need to come to the hospital to do so, for the emergency room. Also encourage anyone that feels they have any sort of healthcare related issue to contact their physician and seek care immediately. Do not delay care.
Okay, and another question to SRMC officials. How are you supporting staff burnout? Other than standard COVID protocols, what can individuals do to slow the spread now?
We've done a number of things to support the health and well-being of our caregivers, including We have an employee assistance program, which is a counseling service that we've offered to our caregivers with unlimited number of visits. We are doing a lot of things internally to support their health and nutrition needs by keeping food and drink available on the various units. We have a couple of other efforts underway that include working to try to find a way to get some just really short massage therapy, stress buster types of massages. Don't have those in place yet. Not sure we're going to be able to, but we're trying ideas and others like those to try to help our staff, in addition to bringing in travelers to help with the exceptional workload, as well as providing some extra compensation incentives to help those staff that are able and willing to work extra shifts.
Jeff, this is Suzanne. We've also set up a support group that is being led by a licensed independent social worker. So really to help provide an opportunity for individuals to share their feelings, to get together and communicate and unburden.
Yeah, that's a great point. Thank you for sharing that, Suzanne. I think we all need to realize that our caregivers have seen much more severe illness and much more death, much more frequently than they ever have before in their careers. And as was shared earlier, not only is the physical burden of caring for these COVID patients heavy, but the emotional strain, often having to serve as the interface between the patient and families for final goodbyes. You can only imagine the continued impact that has on the frontline caregiver, particularly now that this has gone on for 20 months. So again, we want to encourage vaccines, and if you don't get vaccinated for yourself, get vaccinated to protect these frontline caregivers and first responders, not only here at the hospital, but throughout our community. What other questions do you have, Roberta?
Let's see, we have one from a community member. In the absence of individuals willing to vaccinate, it seems the best backup strategy is masking indoors. And the contentiousness of the past 20 months of our local law enforcement has expressed an unwillingness to enforce mask mandates. This forces businesses to choose whether to become mask police with little help from those who job it to protect our community. Has there been any reevaluation of local law enforcement policy to help businesses enforce state mask mandates in our local businesses?
Jeff, I can take that one on. So in covering that, again, we need to recognize this is a very divisive topic that's happened. As law enforcement, yes, it's our job to enforce law, but it's also our job to preserve the peace. And for instance, seatbelts. Everybody knows it's the law that you need to wear your seatbelt. Every day we give out seatbelt tickets. Frankly, we don't have the resources to go out and be the mask police, to issue citations, arrest individuals that may not want to sign a citation. We don't have the resources for that. As individual businesses, you're a private property. You have the ability, no shirt, no shoes, no service, no mask, no service. That's up to you as a business owner to make those decisions, whether you want to hire a private security or whatever it may be. But frankly, law enforcement does not have the resources for that, nor do we want to, in a time where law enforcement is having a very difficult time over the last 2 years, and our relationships are strained with the public. Of course, here in San Juan County, we're very blessed to have good relationships. We don't want this issue, this pandemic. Again, it's not a criminal issue, it's a pandemic issue, and that's what we need to handle it at. So education of the public is by far the best avenue. Citing, clogging our court system, clogging our jails, limiting our resources for emergency calls, for the mask mandate, frankly, just isn't the best course of action.
Yeah, and I would echo what the sheriff's saying. It is going to be a difficult and contentious issue for the police to go and get involved in. We do show up, and we were providing masks to individuals who didn't have them. We're handing those out free here with FPD. We're also educating people on what the state of the law was. The law had been changing a bunch during the course of the initial public health order. It's stabilized here in the last few months. And I think people generally are getting that indoors. They need to be masked up when they're at the grocery store, when they're at businesses. But like the sheriff said, this isn't really a criminal issue. We're not going to arrest you and take you to jail because you don't have a mask on. Like the sheriff said, that's already fraught with its own dangers. The jail has really had an epidemic of its own within the facility from people coming in who have COVID. So taking people up there and putting them in there because they don't have a mask on isn't a particularly realistic solution. So the best we can do really is what we have been doing, which is educate our people, do the best we can to set a good example. You will see me out in public. Unfortunately, I stand out with my hair the way it is, and you will see me in a mask when I'm in businesses. So on behalf of Nicole, thank you.
Thank you, Chief. Dr. Greenberg, there's a question that was asking about the Pfizer pill that is reportedly under development. I think another manufacturer has a pill also under development. Can you comment on those?
Sure, absolutely. I think Merck and Pfizer both have, I would say, antiviral medications, kind of similar to what you would imagine Tamiflu works like for influenza, that both have some promising studies that have associated mortality benefit to those pills. Now, those are not FDA approved yet, not even for emergency use authorization. The preliminary non-peer-reviewed studies and some of the preliminary data from these initial studies was very encouraging. That being said, we look forward, just like the public looks forward, to their complete review by the FDA and the CDC. And if and when they become available for use, we will absolutely deploy them as to minimize the risks of severe COVID in the community.
Thank you, Dr. Greenberg. Roberta, additional questions that you are able to see?
Okay, why are so many people that have received the shot still getting COVID in large numbers? Most are not getting a mild form, but it is bad. Also, those that have already had COVID are getting it 2 to 3 times. What is the cause of this?
Well, I would say that the immune system is somewhat fickle. But I think really what we're seeing here is that the Delta variant is highly infectious. And we're also, so I'll work backwards. So folks that have had COVID can absolutely get COVID again. So, and yes, indeed, as time has moved on, folks are getting it 2 or 3 times. And I also think that let's not forget that one of the common effects of having COVID infection is actually long COVID, which is signs and symptoms of fatigue and other respiratory problems that can persist for months and months. So it's another very good reason to get vaccinated. That being said, we do know that folks that have had the COVID-19 vaccines are indeed getting COVID. But they are, just like you mentioned in the question, a mild form. So I think that is extra important. We need to do all the COVID safe practices. We have to mask up, do hand hygiene, do appropriate social distancing, because that also continues to mitigate the risk. But please, let's not forget here, the vaccines are actually working. Even if you get COVID, you're not going to get the likelihood of you getting severe COVID that results in hospitalization, ICU stays, ventilation, or death is extraordinarily low. And so there's really very high value to getting vaccinated. And so, but I will absolutely, I think we all need to understand that like having the vaccine is not a panacea. It doesn't fix all of the problems, and you have to continue to perform COVID safe practices.
And one final question, I think you guys have touched on it, but it is our final question, a good way to end. What can you say to people who believe it is only the unhealthy with comorbidity that need the vaccine?
Well, it's another great question, and for a very long time, we really talked about vaccine prioritization. Those folks that had significant comorbidities or other illnesses, but what we're actually seeing right now is those folks that have been vaccinated are pretty well protected, and what we're actually seeing right now, unfortunately, in our ICUs, and unfortunately associated with deaths, are folks that are younger, and folks that are not necessarily stricken with the same kinds of comorbidities. Those folks still are at higher risk, but Delta is not going to, folks that have had severe COVID include those that have no comorbidities. So please get vaccinated. Dr. Parahan said that there were millions, at least in the first 6 months that the vaccine was available, 317 million vaccine doses were given. That's a lot of vaccination doses. This is one of the most, actually, I think it is now, the most studied medication in the history of medicine. So this is a very safe medication. It has immense impacts on deaths in the community, hospitalizations in the community. And we in the hospital are relying on each and every one of you to get vaccinated, encourage your friends and family to get vaccinated, and we'll get through the pandemic together.
Thank you, Dr. Greenberg. I'd like to close here in respect of everyone's time. We've run a little over. I want to first thank all of our panelists for participating tonight. We appreciate your leadership in your various roles within our community and everything you do to keep us safe and secure, particularly to our law enforcement partners. We certainly respect and appreciate the challenges you have in your work, and appreciate again all you do. And then I just want to close again to encourage all those listening to continue to practice and use COVID-safe practices. Keep yourself safe. The vaccine, even if you are a low-risk person, can help not only yourself, but help you from unknowingly spreading to a high-risk person. And it would ask that you consider the safety of others as you consider whether or not to get a vaccine if you haven't already. I would certainly err on the side of safety, as I have for myself and my family. So thanks again to everyone for joining us tonight. We appreciate your time and interest into the almost 200 participants that had joined us at the peak of the participation here tonight. Thank you for your interest in joining us tonight. Good night, everyone.